Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web and at Safe Camp Audio on all social media. It is the first Monday of the month, so we are going to do some headlines this week. And as we did last month, we will start on Capitol Hill with a fairly chaotic first month or so of the Trump administration, try to nail down a few things we've been reporting on and hearing. Before we get to that, though, a very quick plug for an awesome event coming up that is co-hosted by our Youth Voices Rising team here. On March 11th, you can join our Youth Voices Rising team and the Coalition for Juvenile Justice for a terrific online conversation called Empowered Youth Voices, Overcoming Imposter Syndrome and Building Confidence in Storytelling. Youth Voices Rising is proud to host this event with the Coalition for Juvenile Justice to amplify the voices of youth with lived experience in the justice and child welfare systems. The coalition brings together advocates, policymakers, and young leaders to promote policies that reduce system involvement and improve support for youth. A key focus is empowering speakers to overcome imposter syndrome, build confidence, and share their stories effectively. So through the coalition's national network and Youth Voices Rising storytelling platform, we are fostering spaces where youth feel heard and valued. This partnership ensures their voices help shape policies and drive meaningful change in the justice system. This event is completely free and virtual. I will post a link to register in our show notes for anybody that wants to go check it out. And you can also register on the Youth Voices Rising Instagram page, which is at Youth Voices Rising. So the last time we did a headlines was just really about a week and a half after President Trump had been inaugurated for the second time. There was really kind of one focal point of the discussion at that point, and that was that basically all of federal funding had been frozen, leaving tons of grantees in the child welfare, youth justice, and family serving space kind of wondering whether or not they would continue to have any federal support for what they were working on. That order, freezing all the grants, was quickly rescinded as the courts also took it up. So it just became very much in flux at the time. That certainly was like an early opening overture to what was to come, because certainly things have continued to be confusing and unstable in terms of just like a funding picture and a structural picture for child welfare and youth justice within the federal government. So I'm going to try to take a stab at just sort of talking a little bit about what we know has gone on in the month, give or take, since we did that last update. I'm going to focus first on sort of funding and federal money and where it's going and where it's not. And then I'll get a little bit to staffing, since the last time I did one of these, the confirmation hearings had really just started for like the top tier cabinet positions. Since that time, we have gained an attorney general in Pam Bondi. We have gained an HHS secretary, Health and Human Services secretary, in the form of Robert F. Kennedy Jr. So those top positions are filled. We're starting to get that acting tier of people who are going to at least temporarily lead on child welfare and youth justice as they start to develop candidates and announce them for some of the top, presidentially appointed and in some cases Senate confirmed jobs to lead on these issues. So from what I've heard, I would say that the way to describe what's happened since the great funding freeze of January 2025 is that money has started to flow out again to federal grantees in our space and in others. But the grants that were in the pipeline, right, that were up for renewal or were in competition, that has been quite a different story. Just take, for example, the Office of Juvenile Justice and Delinquency Prevention. I have it on pretty good authority that organizations have been receiving or been able to draw down funding that they had already been awarded. However, if you go and look at the open competitions that are available on the Office of Juvenile Justice website, before the inauguration, there were probably 5 out there for this fiscal year. All but a tribal technical assistance program were erased even before the federal funding freeze, and those are still not there now. Now, we have also heard, though, that there are, ongoing programs, particularly ones that have these contracts that are, severable along the way, year to year, that have been stopped early. And in fact, some, looming grant competitions that have already been outright canceled. The ones I was just mentioning on the Office of Juvenile Justice, right? I don't know that those have been out and out canceled. There's nothing, publicly available that says that. They have been removed from the website. Presumably the competition has been halted. Last month, we talked about the Child Welfare, Sexual Orientation, and Gender Identity Expression Institute that was, set to be funded by a 5-year contract through the Administration for Children and Families. That was ended basically in its first year. And we have seen more instances of that come up. There was a training and technical assistance program for child welfare and domestic violence agency collaborations to support families. This is an incredibly important and kind of timely topic in child welfare. The extent to which domestic violence exposure in cases bleeds into child welfare and threatens removal of people's children when they are in fact victims of domestic violence. So certainly kind of a topic that is very much front and center in child welfare right now and subject of quite a bit of state legislation that we've covered in the past. We got news that was pretty abruptly canceled, that people who were competing for grants under that competition found out as they were inquiring from the Children's Bureau, which is kind of the place that's most proximate to child welfare funding and policy in the federal government, that was just canceled. We also had another kind of stop and start that freaked a lot of people out when it came to the funding for legal counsel for children who arrive into the United States or at the United States border unaccompanied, without parents, in search of asylum or other protection. So we've talked about this program quite a bit on the podcast before. It's called the Unaccompanied Children's Program. Basically, if you are, often a teenager, sometimes it's even younger children who arrive and kind of present to Border Patrol in search of asylum, the way that those children are handled is very different than if a family or an adult shows up. They're taken by Border Patrol, but then they're handed over to the custody of the Department of Health and Human Services, who's got a whole matrix of shelters and residential programs where these children will live while a sponsor is vetted inside the country. Usually it is a family member or somebody who knows family, might even be a parent who's here. And so they are held in these, residential programs funded by HHS as long as it takes to find somebody. And then the idea is that they will be in the country while their claim of asylum or other status, I always forget what SIJS stands for, but Special Immigrant Juvenile Status, I think, is another one. So they'll be in the country, presumably for the most part living with the sponsors, but there was a very big logistical and logical hole in that program for a very long time. That these young people were expected either to be able to afford their own lawyer to arrive at immigration court with, or what I'm assuming is a very complex argument that you have to make to gain asylum status, or they show up with no lawyer. So picture, 13 or 14 or 15-year-olds trying to make their own legal case before an immigration court for asylum. The practical consequence of that for a long time was that there was pretty solid evidence that when kids actually did show up to court with a lawyer, they were prevailing at a pretty high rate in terms of getting asylum. When a lawyer was not available to them, a lot of times it just led to people not showing up. And then you have just young people disappearing kind of into the ranks of undocumented immigrants who had missed their asylum court dates and things like that. So anyway, in 2022, as part of the federal spending deal for that year, there was several $100 million appropriated for really the first time to put a kind of mass effort towards providing legal counsel to kids who were in this situation. And an organization called Acacia Center for Justice, it's a nonprofit, has the master contract for that. I think there's a lot of different providers that they work with, but it's $1 billion over several years now. They were just issued a stop work order a couple of weeks ago and told this is not happening anymore, which kind of sent chills down the ranks of people who really believe that these children deserve that legal counsel. I would also just add, I mean, this is really, when people talk about like a national foster care system, anybody that knows anything about child welfare knows that doesn't exist. There's not really a national system. There's 50 states, and even within those states, sometimes there's dozens of local child welfare systems. This is pretty much the national foster care system. I mean, we take these kids, put them into residential custody, find places for them to live. It's not exactly an abuse and neglect context like we have, for most of the children who are involved in ours. But it is that system of the state, in this case, the federal government, taking custody temporarily of children and finding a place for them within the country. So anyway, their stop work order was issued. People were worried that this was the beginning of the dismantling of the unaccompanied children's program. And then that was quickly rescinded, just like the federal grant freeze was in January. This has been incredibly fun to report on. There's been a couple times in the past month where, our staff here at the Imprint worked really hard to get some news out there, put it up, and then just right before we hit publish, basically the administration said, just kidding, and stop it in its tracks. So that funding for now has been reinstated. I don't think that completely assuages any fears of people who are worried about the future of this program, only because we've got a looming federal funding deadline that will, I believe it goes down on March 14th, right? If they don't fund the federal government and come to a spending deal by March 14th, the government shuts down, and that is happening in and around the fairly frenetic pace at which the Trump administration and its DOJ office are working to cut programs, cut staff, and all of that stuff. So I expect that this is going to be, from this period on, when you're hearing this on March 3rd, if you listen to it when it comes out, till March 14th, this might be one of the crazier, I don't even know what, horse trading policy battles around funding that we'll ever see in federal government. Because certainly I think there'll be some factions within the Trump administration that will try very hard to get the spending deal tailored around, assumptions of cuts to things they've already done with DOJ or things they want to do with DOJ. I don't think it bodes well for the unaccompanied children program that one of the early moves they made was to stop the legal counsel, and just because it got turned back on. This is speculation on my part, but it might just have been an argument made to somebody that, probably better to just have due process in place until you cut something. Don't give anybody a reason to challenge anything constitutionally. That's just like pure speculation on my part. Nobody told me that. So, I think the story on the funding, if I just had to sum up, was pretty chaotic. Most federal funds that have been awarded are continuing to flow. Grants have been, in some cases, frozen for review. I expect that, a good amount of them will end up being competed out again, unless somehow in a federal spending deal they're cut. And even in that case, I think the current federal money will still get doled out. But there are clear indications that where they feel like they are on decent enough legal ground to just end contracts early, they're doing so. So, the chaos continues for sure on that front. So let's switch gears a little bit to exactly, who is overseeing child welfare policy at the moment and juvenile justice policy, which is certainly temporary because we do expect that in the coming months we'll have names put forth for, official leadership, both at the Administration for Children and Families and its kind of smaller agencies that focus on child welfare, and the Office of Juvenile Justice and Delinquency Prevention. So the Office of Juvenile Justice and Delinquency Prevention, the previous administrator was Liz Ryan during the Biden administration. She stepped away from the office just days before the inauguration. And since then, the acting administrator there has been Eileen Gary, who has been with the Department of Justice for many, many years. So she is in there until the Trump administration appoints somebody to be a permanent political appointee to oversee the office. In the previous Trump administration, that office went with an acting leader for about a year. I believe it was like December of 2017 when President Trump appointed Karen Harp, who was a former prosecutor from Arkansas, to lead that office. The head of OJJDP used to be a place that required Senate confirmation. So you would have to go through a hearing from the Senate Judiciary and then get a full vote from Congress. That got changed during the Obama administration, so there is no longer a need for confirmation. So once they appoint somebody, that will be that, and they will be in. That person, the head of OJJDP, kind of answers directly to whoever is I want to say it's the Associate Attorney General, who leads the Office of Justice Programs. That's basically the much bigger multi-billion-dollar agency that the Office of Juvenile Justice is a part of. Now, my recollection is that actually the Trump administration might have never put a name up. That is a Senate confirmable position. I'm pretty sure they never had somebody go through the confirmation process. I think they just used acting directors for the entirety of that. Who knows this time around whether that will be the case or not. But we will certainly have our eye out and report anytime there is somebody over there at Justice, either in that Office of Justice Programs position or at OJJDP. Over at the Department of Health and Human Services, as I mentioned before, RFK Jr. is confirmed. He will be leading HHS for the foreseeable future. And the corner of HHS where child welfare and family policy is made is the Administration for Children and Families. Within that agency, there is a commissioner of the Administration on Children, Youth, and Families. That's ACYF. And within that ACYF is Children's Bureau, which is actually the oldest of all of these agencies I'm talking about, and is, like I said before, really proximate. Like, that's the one that kind of oversees funding for child welfare services, family services, and the other part of ACYF is the Family and Youth Services Bureau, which is really just kind of a hodgepodge of things that include services for runaway and homeless youth, sexual health and teen pregnancy prevention. It's kind of a weird deal. So for sure, what we can say is that the vetting of candidates to fill some of these positions is well underway. Definitely have heard a few names that are up for consideration that kind of emanate from the state child welfare leadership world. They've got some other people rumored. We'll try to kind of get that down to some intelligent speculation and probably put something out for our subscribers sometime this week, hopefully, if we have time. For now, let's talk about who is leading these federal agencies for the time being as the administration staffs up. So at ACF, the Administration for Children and Families, Trump has put Andrew Grattison in charge as the acting assistant secretary there. Like I said, this is a large division of HHS. It oversees, really a range of family supports and services. Child welfare is one, foster care and adoption, Head Start, welfare, the temporary assistance from needy families program. Grattison comes from not a federal bureaucracy background, but is certainly familiar with the issues at play. He spent almost a decade working at House Ways and Means, which definitely has a lot of influence on child welfare legislation. And then he spent 2 years on the Senate side as a policy advisor for the Health, Education, Labor, and Pensions Committee. So in my experience covering this stuff, I think it's reasonable to expect that it would take the top job at ACF about a year to go from announcing somebody all the way through Senate confirmation. It also doesn't make sense for Grattison as a serious person on policy to take this job if they weren't going to be there for at least a year, I would think. You can bet that that's sort of the plan, is that he will be running that agency, which is the fairly large one, for the foreseeable future, which is sort of also the way that the Biden administration handled it. They put Ju Yen Chang in. I think it wasn't entirely just as an acting. If I remember right, she was sort of made a deputy administrator of ACF and then appointed the acting director of the agency as they worked through getting January Contreras, who ended up becoming the Senate confirmed leader of ACF, eventually into that job. Under Grattison for now at the Administration on Children, Youth, and Families, or ACYF, is Sherry Hoffman. As the acting commissioner there, she was the director of children and youth policy for the Department of Health and Human Services for 5 years and served as the deputy commissioner for ACYF under Rebecca Jones-Gaston, who was the commissioner during the Biden administration. So this ACYF job also requires a Senate confirmation, so Hoffman, like Grattison, could be there for a while. Now, as for Children's Bureau, which, like I said, that's kind of where the rubber meets the road on child welfare funding and policy within HHS, this job is held by an associate commissioner. It's not a Senate-confirmed job, so once a president decides who's going to be in there, they're there. The Trump administration in the first go around had Jerry Milner here. During the Biden administration was Asia Schomburg. And then after Schomburg departed the Biden administration, the commissioner of ACYF, who was Rebecca Jones-Gaston, put in an acting director named Krista Thomas to lead the Children's Bureau. And Ms. Thomas came over from Chapin Hall, where she has been a sort of policy fellow and child welfare expert for about a decade. Before that, she was actually in the federal government working in the Children's Bureau before, so she knew her way around, was brought in for some continuity, I'm assuming. I have since learned that in these first 4 weeks or so of the Trump administration, she has resigned. Not really clear what exactly the motivation was there for her departure, but it is probably worth noting at this point that, we have heard here at the Imprint from our sources that, more than a dozen people at the Administration for Children, Youth, and Families, ACYF, have been let go as part of the large effort to cut federal jobs that is being undertaken by this DOGE office, and that a lot of those people who were let go within ACYF are Children's Bureau employees, which is not really surprising since Children's Bureau is a fairly large part of that whole contingency. So we'll certainly try to learn more about that as we continue to report on things. According to the ACF website right now, the new acting head of the Children's Bureau is longtime Children's Bureau staffer Joe Bach. The last thing I just kind of wanted to riff on, but I will definitely link to our story about this that we put out for subscribers, and I'll put the link in the show notes for people who want to read about it. This is not necessarily about federal jobs or who is leading the agency, but I did want to just mention that some of the early actions by the Trump administration, in particular, this funding freeze, the uncertainty around future grants, and the executive order on diversity, equity, and inclusion have had a deleterious impact for sure on some of the paid opportunities to work on federal policy for young people who have lived experience in foster care. So during the first Trump administration, I mentioned that Jerry Milner was the associate commissioner at the Children's Bureau, and he really worked into a lot of federal grants, sort of a requirement really that they incorporate lived experience into the grants and the contracts, that they are being advised by young people who could help them from a kind of bird's eye view, shape policy and training and all kinds of different points of expertise around system design and things like that. And I'm just going to quote Mr. Milner from the story that we wrote about this. At the time, the word inclusion had not become politicized and had the simple common sense meaning of promoting personal agency and self-determination. To me, it meant and continues to mean people should not just have a say in what government can do to them, but an active role in shaping what and how it can show up in their lives. So, as I said, I would really encourage you to read the kind of rundown that we put out about this, but suffice to say, the freezing of federal grants led to a lot of instability, rightfully so. People who had received child welfare grants that had incorporated lived experience and lived experience advisors into their project about whether they would even be continuing to do this work. And so that led to notifications going out to some people who were federal contractors who had lived experience saying, basically like, we don't know what's going on. We don't know if we'll continue. We're going to stop all invoicing. And, these are in some cases, young people who were doing other things left to take a full-time, contract position doing this work. And we quote one of them in the story. In another case, there was uncertainty as to whether this inclusion of lived experience in these grants would be construed and determined to be a diversity, equity, and inclusion effort. And in so, construing that they would be canceled, because that was sort of where things are going. I know this is all tied up in pretty complex lawsuits and things that the Supreme Court will certainly probably end up ruling on sometime in the near future. But in at least one case, we obtained communication that basically said that at least one child welfare organization who had a contract with the federal government sort of proactively ended their lived experience advisory group because they were sort of advised to do that in advance of kind of more formal clarification by the federal government. So this is a situation in which you got young people who, in some cases, this is their only paid gig, being really put into flux by what's going on with both, executive orders around DEI and just the overall uncertainty of what is going to be funded, what is being frozen, what's going to get canceled, what's going to get rewritten, and all that stuff. So that's a very unfortunate corner of this whole story. I would definitely, again, just recommend that you read that, and we are going to continue to stay up on that here at the Imprint. All right, just a few other, DC stories for this month. I think we'll wrap it up on that. I do promise to get back to some local headlines because there's a lot of interesting stuff going on elsewhere in the country, and we'll get back to that in the April headlines. But just a few more things out of Washington. One was a fairly interesting Government Accountability Office report on the coverage of former foster youth under the Medicaid program. And obviously this takes on kind of an added import now because, like I mentioned, the federal spending runs out in the middle of March. We will be dealing with keeping the government open while also working on what seems to be a reconciliation bill that may set entirely new parameters around federal spending and taxes for the 10-year window. And one of the things that will be front and center in that process will be whether or not Republicans move towards cuts to the Medicaid program. Now, I think most people understand generally what Medicaid is. It's an entitlement program. It's a matched amount of money guaranteed from the federal government. I'm simplifying it way down here because it's a super complex thing, to provide health insurance and mental health services and things like that to low-income individuals. And as part of the Affordable Care Act, there was a sort of an offer of more federal resources to help states that were willing to expand Medicaid to include people, a little further up from the federal poverty line. So Medicaid has gotten bigger. It's also covered many, many more people, and it's a provider of healthcare for more than 100 million people in the country at this point, including a lot of kids. And it's just intrinsically enmeshed in everything about child welfare. Every child who is in foster care is categorically eligible for Medicaid. Medicaid is an increasing payer of services within that foster care and adoption realm. Also, obviously, the provision of health services and mental health services for low-income children. I don't know what the research would say is the exact causal connection here, but certainly the absence of it for some families would put them more at risk of being, involved with child protection at some point. I don't think that's out of bounds to say. So Medicaid is everywhere. And then sort of one piece of that Medicaid relation to child welfare is that as part of the Affordable Care Act, the categorical eligibility of foster youth was extended not only to when they were in care, but for the years afterwards. So basically, every person who experienced foster care and aged out of that system and exited as an adult would be entitled to Medicaid eligibility through the age of 26. So that was, and that age was intentional. That's the age at which, any child of a parent can stay on their parents' health insurance through that. So that was meant to match that. There have been, snags and loopholes in this, starting with probably the biggest one being that in the original Affordable Care Act legislation, it wasn't really made clear that if a foster youth moves to another state, that state would have to be providing them with Medicaid, and that's been kind of cleaned up in legislation since. Anyway, this GAO report, they were instructed to look and see how many former foster youth were covered each year by Medicaid as a result of that Affordable Care Act change. So what they found, they were able to kind of look into 46 states. There were 4 states where the numbers were just not good enough, or the data was not reliable enough. They found that in 2023, 112,000 former foster youth between the ages of 18 and 26 were enrolled in Medicaid under the eligibility code for former foster youth. So that's its own kind of unique identifier. They make it clear that it's certainly possible that there are, maybe even thousands of other former foster youth who are covered under Medicaid, but just under a different code, perhaps if they were pregnant or parenting or something like that. The range of kids covered was from 70 in Washington, D.C., which has a very small child welfare system, obviously, to 26,000 in California. And because many states now offer extended foster care through the age of 21, the vast majority of the enrollees in this former foster youth Medicaid category are between the ages of 21 and 25. Because if you're electing to stay in foster care from 18 to 21, you're just sort of counted as categorically eligible as a foster youth. The problem with this report, I don't know, I can say it's a problem, but I guess it's like a thing that leaves you wanting to know more, is there's no denominator. They're just telling you how many youth were covered, or former foster youth were covered in this year, but it's not answering like out of how many. They don't have even an estimate in here of how many of basically like the 112,000 former foster youth covered. Is that out of 300,000 that should be? Is that pretty much all of them that should be? It's really hard to tell. Just back of the envelope, though, if you kind of operate on the knowledge that about 20,000 foster youth age out into adulthood every year, which has pretty consistently been true. It's been higher in previous years. I'd say more, it's like trending towards 18,000 now. That would roughly translate to 160,000 people in that 18 to 26 range at any time. If you just did that very simple math of like 20,000 times the number of years in that age range. And so if you assume that a good chunk of the 18 to 21 crowd is remaining in foster care so that they're not really eligible for this Medicaid designation, and then you factor in that there's these 4 states with such crappy Medicaid data that they couldn't figure it out, it actually kind of feels to me like there's a very high rate of eligible people who are getting enrolled in Medicaid and staying on it till 26. But if you have a different take on that, though, for you disagree with me there, I would love to hear it. I don't want to be Pollyannish about it. It did sound like, once I kind of mathed it out, like that is actually a pretty high rate, but different perspectives welcome on this one. tips@imprintnews.org if you want to weigh in. But certainly Medicaid is going to be front and center as we talk about the future of federal funding here in the coming weeks. And so wanted to mention the GAO's work on this particular corner of the intersection between Medicaid and child welfare. Okay, last thing for real today is just a modest piece of legislation I wanted to mention because it is kind of timely to me. Introduced by Senators Amy Klobuchar of Minnesota and Kevin Cramer of North Dakota. It's called the Adopted Children and Families Act. I think this is the second go-around for this. I think it went into the hopper last year. The idea here is to provide what I believe would be the first kind of mandatory post-adoption support services tied to federal funding. So if I could just explain it a little bit here, there's kind of 2 segments of the Social Security Act through which most federal child welfare funding flows. Title 4E is the big one. It's an entitlement. That money goes to now preventing foster care from happening in some cases, to foster care payments, and it goes to adoption subsidies that are paid to adoptive parents who take kids from foster care. The other one is called Title 4B. That is a block of money sent out to the states each year, and that has like a very flexible range of uses that includes like upstream family prevention, preservation services, all the way to post-adoption services. But there's not really like an actual requirement that any of that money be spent on supporting adoptive parents and children. And I think that why I describe this as kind of timely up front is we had like maybe a couple of years ago now, big expose by USA Today on, in particular, how many older youth are experiencing disruptions from adoption after foster care. They're heading back into foster care. You have a recent big body of research from the federal government that we reported on and talked about, I think, on last week's podcast, about the fairly surprising rate at which foster care entries are connected to relinquishments, meaning that parents are surrendering custody essentially of their kids. And while it didn't kind of expressly say that in the report, definitely the feedback we got after we put out the stories was, I really wonder how often these relinquishments involve a child who had been adopted. So Senators Klobuchar and Cramer are trying to kind of bake in some guarantee of federal funding going to post-adoption services. The way they would do that was essentially by increasing the overall amount of authorization money to 4B by $20 million and then earmarking that new amount for adoption support. So that, 4B would essentially be this fairly sizable pot of flexible money. But if you're drawing down from this little corner of $20 million, that has to be for post-adoption services. I do think there's an adoption incentive program that kind of rewards states for increasing the number of either kinship guardian or adoptive placements on a fairly complex scale that sort of measures year to year, but also like against recent trend performance and all that stuff. I do think there is like a somewhat modest requirement that those adoption incentives be used to some extent to fund post-adoption services. But this is a much more clear requirement that goes into law if this moves, which who knows what legislating is going to be like this year. But it's not a lot of money. It's bipartisan. So you got to figure it has a decent shot of maybe getting rolled into something if there is a child welfare package to be had this year. So we'll wrap it up on that. I promise I will get to some state headlines and some interesting stuff going on outside of Washington. I mean, obviously, what's going on with the administration and with job changes and federal funding is a big deal right now, but certainly there are many other interesting things going on in the country. So we'll get back to that, I promise, in April. This podcast is produced and mixed by Christine Onjoko with the music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we'd greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.